Hello, Haruna.
Hello, Hiroshi.
Yeah, how are you?
I'm fine. How you doing?
Yeah, okay. Um, so you are the doctor, right? You are a doctor,
Oh, yes, I am.
right? And you are in a clinic.
Yeah, well, I'm currently in the clinic, yo.
And tell me, where are you located?
I'm located in Kano. That's the northwest part of Nigeria.
I see, I understand. So now
Mm.
there are corona pandemic over there too.
Oh, yeah, yeah.
Are you?
We got our first case about 3 weeks ago, and so far we've had more than 20 cases in Kano.
Are you having a patient too?
A patient? You mean, am I managing a patient with COVID-19?
Exactly.
No, I'm not personally managing a COVID-19 patient. But I'm a family physician, so I work in the outpatient department. It's a gateway to the hospital, and we see all patients from various communities, and it's sort of a portal for getting patients and filtering them and sending them for tests.
Kind of test to find out whether they are infected or not.
Exactly. Yeah.
How do you expect in a really near future you gonna have a lot of patients or not?
Well, predictions are predictions, right? But from the way things are going, I really expect a lot of patients in the near future. Probably from community transmission. Yeah.
I see. So which means like transmission from the. Tell me more about it.
Yeah. So community transmission is transmission from individuals within the community.
Yes.
In contrast to transmission from outside, because the state borders have been closed for about 3 weeks now, and the index case we had actually came in before the state border. Just around when the state borders were closed, and some other people came into town, and they tested positive, and we've been having little crops of positive patients around. Yeah.
So community means like creating some kind of clusters of the, coronavirus.
Yes.
Do you have enough equipment over there? Like a ventilator?
No, we don't.
Oh, that's problem.
Considering the size of the population, the population of Kano, I think it should be about 11, 12 million people. And we have, so far we have 2 tertiary healthcare centers and about 2 centers dedicated for COVID-19 and 3 more isolation centers.
I see.
So these centers are a little bit limited in terms of equipment. Well, we have ventilators, to cater for a lot of people, but it may not be enough if the community transmission continues and we keep on having COVID-19 patients here.
Oh, I see. So, for example, like how many ventilators, for example, you need more for future?
Well, I can't say exactly, really, because I'm not handling it directly. But initially, before this, we had about, I think we had about 20 something to 30 ventilators, I think, which is grossly inadequate. To my own belief, if we can have about 100 more, 200, with
okay,
equipment, that'll work.
I see. How about the PPE, like clothes and the mask, something like this? You have enough?
Well, that's grossly inadequate, really, just like everywhere else.
That's right. I see. So you go ahead.
But it's even more inadequate here. The PPEs are usually found in the COVID management centers. You don't find them in other healthcare centers, and the face masks got depleted. Face masks, gloves, coats, and eye shields, facial shields. They got depleted shortly after the announcement of the first case.
Oh, I see.
And and we've been having difficulties in getting them from the NCDC and from the federal government because of resource allocation and finding on needs based. And so some of us really have to buy our equipment ourselves. Okay, we're doing this for humanity, and the equipment are kind of expensive right now. The costs have skyrocketed to about 300, 400, 500% of usual.
Right.
Yeah.
I see. So, that case, you have to be prepared from now a lot. It's a really tough job.
Yeah, exactly. Yeah, it's really tough. It's a really tough job. Lots of hand washing. Well, I can say there are a lot of initiatives to distance people from each other.
Exactly.
Yeah. Crowds have reduced, and the government is trying very, very hard to do that. It's instituted a lockdown about a week ago in Kano. Yeah, just about a week ago. Yeah, and mainly focuses on businesses because we realize once you lock down businesses, people ain't gonna move around. And some other things like other congregations in religious activities, government is trying to bring them down to.
I see. As a doctor's point of view, right now, what is the most important things for you to need?
From the healthcare point of view, I think the most important thing right now is personal protective equipment and testing kits.
I see. Testing kits and personal equipment. I see. Because it's risk yourself, I believe.
It's very risky, being over here.
Oh.
Yeah.
Because COVID-19 is really strange virus because even kind of hot weather, it is spreading.
Yes, exactly. They've been furious about the hot weather being kind of protective, but I don't think it is because it's spreading really wildly over here.
Oh, really? Yeah, exactly. Like Nigeria, it's a really hot place, and then not like Japan. Japan still it is really cool, but even Nigeria, this virus is going out quite a lot. So.
Yeah, sure.
So, what is your daily life right now?
I didn't get you.
Excuse me. What is your daily life right now? Tell me. I mean, you are now inside the hospital only. You can go back to the house.
Oh yeah. I can actually. So despite the lockdown, some very, very essential services are allowed to move around. Basically, like I do, I move from the clinic, from the hospital back home. That's my daily routine. Yeah.
I see. And how many patients and how many communities do you have to take care? For example, like how many kilometers?
Like my hospital, it's a tertiary healthcare center, really. So before this COVID-19, we take care of the whole population of the state on referral basis, and the neighboring states, and even across, from out of the country, like the Niger Republic, Cameroon, patients trickle around.
Oh.
But but now, because of the restriction of movement, we get patients from all over the state. Because when you're sick, you got to go to the hospital.
It's a big number.
It's a very large number, very, very large number.
And how many doctors you have right now?
In the hospital? In the whole hospital, we have more than 300 doctors, really, in various capacities, in various departments, and working in various cadres, right?
I see.
And well, they're all essential services. So, exactly.
Okay, I understand. So you have a big hospital right now. There are 300 doctors working on, but you have to receive the people from all over the nations.
Yeah, from all over the state and neighboring states.
Wow. I understand.
Yeah.
It's really, so now you are making a lot of preparation in that case. Really like a,
Yes.
and
Yes, a lot of preparations are going on.
for example,
Okay, fine. From the state government perspective, talking about the locking down and crowd control, providing as much PPEs as they can provide, sending messages, communication through the social media, through the TV stations and the radio stations. I really commend the state government in terms of communication. They're given the relatively good content and through good media to enlighten the population about what to do and how to avoid being infected and reducing community transmission. Preparations from the hospital. We've got some, mini decisions about how to control our services, how to still carry on our services, and at the same time reduce crowd in the hospitals.
Yeah.
For example, hitherto this pandemic, you can find about 200, 300 people waiting in line in my own department, which is the family medicine department.
Sure.
So we had to cut it down to about 50 at a time. We spread them around and we keep them at least 2 meters away. We try to do that. And those waiting outside, we had to provide sheds outside for them.
Oh, yeah.
Yeah, exactly, to stay. And also, from in terms of preparation, from our own point of view, we had to make protocols on how to see patients, how to screen for COVID patients, suspected cases and probable cases, how to link them up to testing through the NCDC. NCDC is the Nigerian Center for Disease Control. So we've got contact personnel in the hospital, and we've got their phone numbers, and anyone we find to be suspected, we call them, and they call the rapid response team. Now the rapid response team, it's a team made in conjunction with the State Health Ministry and the National Center for Disease Control, that comes in on request into the community or in the hospitals to fish out suspected cases, interview them and run some tests on them, run the COVID-19 tests on them, and find probably cases.
I understand. Two last questions. One, because you had experience of the Ebola pandemic long time ago.
Yeah.
And you learn from that pandemic to prepare for this case. This is the first question. How about that?
Can you come again?
Oh, well, I tell you, because you had a kind of a Ebola disease experience.
Yeah.
And did you learn something from that disease to prepare for this pandemic?
Oh, yes. Yeah, sure. Definitely. Yeah, sure. Definitely. In terms of the Ebola pandemic, it was more of border control, really. People coming in and moving out. It's more of migration and immigration.
Sure.
Movement of people, and that was what really helped. And number two, and which I think is equally important, is the screening. The screening services we had at the ports, at the airports, at the borders.
I see.
You're coming in, your temperature get checked, and once it's high, you're moved into another stage and you get triaged. And from the triage, we'll be able to know whether you are carrying the virus or not, and you will get moved straight into isolation.
So that can be applied for these new cases too.
Yes, it can be applied. It's already applied here, but the difference is, I think, between Ebola and this current pandemic is in terms of the infectivity. This infectivity here right now, it's extremely high, and unlike Ebola, that you can talk about, body and bodily fluids and contamination. In this case, it's kind of really more elusive.
I understand. Last question.
Yeah.
From Nigeria, please give us a message based on this pandemics. Give us message. Are there any kind of suggestion or anything, you have in your mind?
To the whole world, people of Nigeria are really, really suffering this. Not just the cases, the morbidity and the mortality, but we're really suffering the economic aspect of this. And we cannot be able to predict how much is going to hit us in the next few months, to even a year or more. And our healthcare system is already overstretched, and we will welcome any kind of help from anywhere in the world.
That's good.
Yeah. Thank you.
Please stay healthy and also be careful. And also, I hope that you can get over it.
Thank you so much.
Thank
you so very
you.
much.
Bye bye. Take care. はい、ナイジェリアの、春菜さん、ドクターなんですよね。首都から50キロぐらい離れたところの、あるメディカルセンターに勤務してらっしゃる人なんですけどね。今ちょっと話を聞いててもつくづく思ったんですけれども、まさにですね、アフリカってこれからでなんですよね、コロナがね。で、300ケースとかいくつかケースがナイジェリアの中でも見られてきてるんですけども、いよいよこれからいよいよ戦場になると、その前の状況、そこをまさにね、コロナという敵が攻めてくる、その対してどうやってこれから守っていこうかと、そういう緊張感、すごくにこやかに話してくださってますけども、命がけの戦いの前の緊張感が本当にひしと伝わってきました。ともかくね、例えば、マスクだとか、それからそのフェイスを守るものね、顔を守る、プラスチックのもの、そういうものですよね。そういう防護服、それからあと、そういう酸素吸入器なんかの基本的なそういうものをもっともっと欲しいと。それから、人々が、来た時にどうやってこれを整理するか、外で待たせないといけないから、それを影でね、日陰を作らないといけないとか、アフリカならではのね、そういういろんな事情を聞くことができました。あとですね、エボラ出血熱が近くで発生していたことがあるので、そのことについてね、聞きましたが、なんて言うんでしょうか、今回のことに、その経験がね、どう活かせるかと。ともかく、国境をしっかりと封鎖して、そして、飛行場でしっかりとチェックをする。これができるとかできないかということが非常に大きな、分かれ道になるから、今回はね、国内だけでしっかりとケアしていきたいというコメントですね。ともかく、これからなんですよね。なんとか、元気で頑張っていただければなと思っています。さて、じゃあ、また次の国を訪ねてみたいと思います。